the first COVID-19 vaccine was developed based on the first wave of the variant, and the doses of vaccines being delivered were tailored, or should I say were trialed on the variant that was known about at that time. But since the emergence of COVID-19 variant 501Y.V2, questions have been asked about how this variant will react to the current vaccines. Well, joining us to answer these questions, we are joined by Sandile Cele, a research lab technologist with the Africa Health Research Institute. Mr. Cele, thank you very much for your time. Perhaps let's deal with that very first question. So the country receiving the first batch of COVID-19 vaccines yesterday. Talk to us about how effective they are going to be in treating COVID-19 patients who might be carrying this new variant.
Good morning to you, and good morning to the viewers as well. It's very exciting that we finally got a first batch of the vaccine. So here at the Africa Health Research Institute, we have done some research. We have been doing the research on the new variant. However, the research that we've been doing, we've been looking at the antibodies from the recovered patients to see if they do recognize the new variant. And the findings that we have is that the antibodies do recognize the new variant, but not as well as they recognized the variant that was infecting during the first wave. So there's no evidence that the vaccines shouldn't work.
Does that conclude then that scientifically, whatever variant may emerge, and just out of interest, by the way, you have been doing some research on this new variant that emerged here. Is that the only variant we are talking about, or are there other variants? And obviously linked to that question, is it a foregone conclusion that these vaccines being developed now, which we said earlier, were based on the initial COVID-19 outbreak last year? Is it a proven fact scientifically that they will definitely work to prevent the symptoms?
Well, to answer your first question, obviously the virus mutates like every time. There are more variants, but this is the most concerning variant. As we know, there are 3 mutations, major mutations on the spike virus when it comes to this one. So this is the most studied variant that we know of. Obviously, there might be other existing variants.
Why is this one?
As
sorry to interrupt you. I keep interrupting you because this is a very interesting conversation. So why is this variant the most concerning one? Because in my head, yes, we have heard scientists saying its impact on the human body is not that different to what we saw in the early stages when the outbreak happened in the country. But the difference, though, Mr. Cele, is that lots more people have died in a short space of time.
I think what makes this variant more concerning is its transmission rate. As we all know, it was first discovered in the Eastern Cape, in the Nelson Mandela Bay. And then it spread so quickly around South Africa. That makes it the dominating variant. I think that's why more studies are going towards understanding it better.
And any links to the fatality rate we have been seeing, or you must understand the concern here, Mr. Cele. The concern is that we are in the summer season where people were expecting the most number of deaths as a result of COVID-19 would have been during the winter months. These deaths are occurring in the middle of summer in South Africa, and I guess on the continent as well. And we initially thought that this virus is much more is much more deadly in the winter season?
I wouldn't say the virus is much more deadly now. I think there is no evidence that say the high number of deaths is because of the new variant. I think the new variant is more transmissible, which translates to more cases.
Yes.
I think the more cases you have and the more deaths you get. I think that's all it is. There is no evidence that links the two.
Yeah. So as a researcher then, have you not made any effort to try and find out why, though, we are seeing so many people dying as a result of this virus right in the middle of summer?
As a lab, you have certain things that you can do, capabilities. That's why there are so many different research groups. Every group do their part and the other groups do their parts. In here, we do not do such research. So I cannot answer that question.
Okay, all right. And so you have also mentioned that there are a lot more other variants, but of course the specific one we're talking about is this 501Y.V2. Why? How many are there that exist now besides this one that we have just dealt with?
That's a really difficult question to answer. As you may have heard, the new variant has more mutations. I think it's about 15 or so mutations. You might get some mutations where there's only one mutation, there's two mutations. However, we are limited by genomics. You have to sequence like every virus to know exactly the genomic makeup. So it's difficult to answer that question.
Yeah. And what piqued your interest about this? I mean, I suppose if you are doing research in the medical field, this is one hell of a virus that has basically gripped the entire world. So perhaps it makes sense. But what piqued your particular interest as to why you needed to do research on this? And also, how do you grow a virus in order to determine its revolution or its evolution rather?
Okay. This is part of my PhD project. So last year, I have been employed at Africa Health Research Institute for 6 years now. So last year I decided, okay, come this year, I'm going to do my PhD. And then I registered with the University of KwaZulu-Natal. And then there was this first case of corona in South Africa. Then we sat down with my boss, Dr. Alex Segal, who then said, maybe I should focus on this new research. And then I saw it as a great opportunity to get involved and then do what we do.
So any other findings that you have since discovered, something perhaps you have not spoken about that might become a topic of discussion, not just in the country, but perhaps in other parts of the world? I mean, when this variant was discovered, it became a major concern, particularly in countries like the UK, for example.
I must say we have been busy ever since the emergence of this new variant.
Yeah.
And we are working, we are getting results, and they will be communicated through the right channels once we have compiled them together.
So you're saying there are new discoveries, but you're not going to tell us just yet?
I'm not saying that at all. I'm saying we've been busy, we're working hard, we're getting work done. When the time is right, we're going to compile and then communicate our findings.
All right. The other important question that's been asked, Sandile, is whether or not you can be reinfected. And I think, if memory serves, that has already been concluded that you can be reinfected with the coronavirus if you have been infected before, right?
The question, though, will be how many cases do we have of reinfection to make such a statement that you can be reinfected? Because what we do here in the lab, like as I've said, we are looking at the antibodies of people that have recovered from the first wave and then testing those against the new variant to see if they actually recognize it. And there is some level of recognition, which makes me believe that it's very unlikely that a person will get reinfected, even though there are few cases of reinfection mentioned there and there. But to be certain, while we need to get the virus that was infecting during the first wave, and then the new variant, and then sequence these two and see if it's actually different viruses that infected that particular individual.
Yeah. Okay. So you're saying that there is 1 in 1,000 chances that if you have been infected, you can be reinfected. And yes, it has been said that some people have been reinfected, but are you saying that those cases are far and few in between?
Yeah, there are very few cases that have been reported of suspected reinfection.
I see. All right. Then there is, and I wonder, I'm simply throwing this out to you because it's something that has just landed on our news desk. It's AfriForum, which wanted the use of the treatment ivermectin to be used on COVID-19 patients. I'm not sure what your knowledge is around the treatment of this vaccine, but it would appear that they've won at least the first leg, which allows for doctors to treat patients with ivermectin without necessarily having to get pre-authorization. Are you aware of the workings of ivermectin, and what would your comment be now that it would appear doctors have some permission to use to treat patients of COVID-19?
This is the area of, I don't have any expertise. I know what ivermectin is. Yeah. I know what it does. I know how it works. I know the mechanism of action, but I cannot really comment on this.
All right. Thank you very much for your time. I did say I was trying my luck, but thank you for affording us your time. And I release you now back to your studies, Sandile Cele, a researcher. And thank you very much for your time.